Well, Rachel Astall is a member of the UK Youth Parliament's Health Committee and she's in our Birmingham studio tonight. Rachel, welcome to News 24.
Good evening.
How high on the list of priorities of the UK Youth Parliament is sexual health?
It's one of our national campaigns. It's one of our 3 national campaigns. It's something that we focus on locally, regionally and nationally. We recently compiled a report that 20,000 young people took part in and handed that into the Houses of Parliament, which received a really good response. It's definitely something that young people are interested in and it's definitely something we're taking forwards.
But the very shocking statistics that we're hearing today would suggest that the safe sex message is not necessarily getting through to lots of people, including that important group of young people. What can be done about that?
I believe it's education. SRE in schools, that's sex and relationships education, is poor. We took a study of young people and a very, very high percentage, nearly 75% of people said that their sex education was very poor or just average. Better education in schools would give people the skills and the knowledge to be able to deal with the risks of sex and would be able to limit their chances of getting these kind of diseases.
Now, there was a big ad campaign some 20 years ago, an HIV/AIDS campaign. Obviously, the people that you represent, you won't remember that. Is the government doing enough in terms of ad campaigns, other means of, aside from sex education in schools, other means of warning young people of the dangers of unprotected sex?
The new adverts I actually think are extremely good, but I think more should be done to make young people and everyone else aware of the dangers that are posed by not using condoms and by not taking part in safe sex. And I think the government really should consider upping the funding for family planning clinics, gum clinics and advertising to make sure everyone knows what they should be doing in that area.
Even if they do that, though, do you think that young people are reluctant to come forward and get themselves tested, not just for HIV but for other sexually transmitted diseases?
No, I don't actually. The report issued by the Health Department today showed that a higher percentage of people took up voluntary testing between the ages of 16 and 25 as opposed to people aged over 25, which clearly shows that young people are keen to get tested and they will do it if they know they can do it.
But clearly there's a group out there who are acting irresponsibly. How do you get the message through to them?
Again, I really do think it's about education. I think if relationships education was taught from a younger age and then the sex part of the education was brought in later on, I think then people would be more aware, more responsible, and we wouldn't have the problems that we're seeing today.
So you think it's starting talking about relationships at what sort of age?
I actually think relationship education should start in primary school. It's something that a lot of people think is very contentious to say, but it's not teaching young people to have sex, it's teaching them about relationships and it's teaching them about the quality of relationships that they can have, and then building on that as they reach secondary school age and throughout their secondary school age career so that they understand the measures that safe sex can have in a healthy relationship.
So you think that the sort of group that you represent, that people are generally not complacent about safe sex in that age group? Because that's not necessarily what we've been hearing from other people working in this area.
No, I think there is a certain percentage who are treating it in a very irresponsible way. But I think if the information was given to them to be able to deal with the situations better, then they wouldn't be acting in that manner.
OK, Rachel Astall, thank you very much. Rachel Astall, Deputy Member of the Youth Parliament.